grades 3 and 8. Measuring is the only way to know whether all our children are learning. And I want to know, because I refuse to leave any child behind in America. Critics of testing contend it distracts from learning. They talk about teaching to the test. But let's put that logic to the test. If you test a child on basic math and reading skills and you're teaching to the test, you're teaching math and reading. And that's the whole idea. As standards rise, local schools will need more flexibility to meet them. So we must streamline the dozens of federal education programs into 5 and let states spend money in those categories as they see fit. Schools will be given a reasonable chance to improve and the support to do so. Yet if they don't, if they continue to fail, we must give parents and students different options: a better public school, a private school, tutoring, or a charter school. In the end, every child in a bad situation must be given a better choice, because when it comes to our children, failure is simply not an option. Another priority in my budget is to keep the vital promises of Medicare and Social Security, and together we will do so. To meet the health care needs of all America's seniors, we double the Medicare budget over the next 10 years. My budget dedicates $238 billion to Medicare next year alone, enough to fund all current programs and to begin a new prescription drug benefit for low-income seniors. No senior in America should have to choose between buying food and buying prescriptions. To make sure the retirement savings of America's seniors are not diverted into any other program, my budget protects all $2.6 trillion of the Social Security surplus for Social Security and for Social Security alone. My budget puts a priority on access to health care without telling Americans what doctor they have to see or what coverage they must choose. Many working Americans do not have health care coverage, so we will help them buy their own insurance with refundable tax credits. And to provide quality care in low-income neighborhoods. Over the next 5 years, we will double the number of people served at community health care centers. And we will address the concerns of those who have health coverage, yet worry their insurance company doesn't care and won't pay. Together, this Congress and this President will find common ground to make sure doctors make medical decisions and patients get the health care they deserve with a patient's Bill of Rights. When it comes to their health, people want to get the medical care they need, not be forced to go to court because they didn't get it. We will ensure access to the courts for those with legitimate claims. But first, let's put in place a strong independent review so we promote quality health care, not frivolous lawsuits. My budget also increases funding for medical research, which gives hope to many who struggle with serious disease. Our prayers tonight are with one of your own who is engaged in his own fight against cancer, a fine representative and a good man, Congressman Joe Moakley. I can think of no more appropriate tribute to Joe than to have the Congress finish the job of doubling the budget for the National Institutes of Health. My new Freedom Initiative for Americans with Disabilities funds new technologies, expands opportunities to work, and makes our society more welcoming. For the more than 50 million Americans with disabilities, we must continue to break down barriers to equality. The budget I propose to you also supports the people who keep our country strong and free, the men and women who serve in the United States military. I'm requesting $5.7 billion in increased military pay and benefits and health care and housing. Our men and women in uniform give America their best, and we owe them our support. America's veterans honored their commitment to our country through their military service. I will honor our commitment to them with $1 billion increase to ensure better access to quality care